Introduction. A Public Health Emergency Operations Center, PHEOC, serves as a hub for better coordinating the preparation, response, and recovery for public health emergencies. A functional PHEOC is critical for the implementation of the International Health Regulations, IHR 2005. The framework for a Public Health Emergency Operations Center provides high-level guidance for establishing or strengthening a PHEOC. Point 1. To establish and/or strengthen a PHEOC, it is vital for member states to align with standardized policies, guidelines, and tools. Laws are foundational to public health practice. Two laws establish and delineate the missions of public health agencies, provide authority and scope of public health functions, and appropriate necessary funds. Point 3. Law, along with epidemiology, is an essential tool in public health practice. Point 4. Increasingly, law is being recognized and used as a tool for improving health on the global stage. Point 5. Public health law can establish governmental authorities for many public health activities, including coordinating responses to public health threats, creating and promoting healthier environments, and generating the information base needed for timely action and policies. Point 5. Thus, as countries strive to continue to strengthen public health systems, international and national legal frameworks can play a critical role in assisting governments to improve their health infrastructures and operations. Point 6. This document provides the required guidance to member states for establishing and/or strengthening legal authorities for a PHEOC and describes the process of developing or amending country-specific legal frameworks. It will serve as a reference to the member states of the African region to adapt their PHEOC legal instruments as necessary, in line with the laws and practices of each sovereign state. The PHEOC Legal Framework Guide also includes information on the stakeholder engagement process and key considerations for potential inclusion in the national sphere of each member state. 3. Rationale and justification for the development of the PHEOC Legal Framework Guide. PHEOCs serve as a nerve center for preparing and responding to public health emergencies. He recommends that PHEOCs develop a legal instrument to authorize the PHEOC itself as well as the specific roles and responsibilities that control PHEOC organizational and operational activities at all times. The PHEOC Legal Framework Guide can be used by member states of the Africa region as a reference to guide development of country-specific legal instruments adapted to the specific country context. Developing legal authorities for a PHEOC is essential to managing public health emergencies. Point 1. Legal authority can help outline the PHEOC's roles and responsibilities, its coordination mechanisms with national and international disaster management resources, funding mechanism for the operations of a PHEOC, among other roles and responsibilities. Point 1. Legal authority for a PHEOC can help provide clear scope of authorities to ensure clear response to public health emergencies in order to ensure optimal and effective use of the staff, facility, and resources. Point 1. Public health law can be defined as the study of the legal powers and duties of the state, in collaboration with its partners, to assure the conditions for people to be healthy, and the limitations on the power of the state to constrain the autonomy, privacy, liberty, and proprietary or other legally protected interests of individuals for the common good. Point 2. 6. PHEOC Legal Framework Guide. 4. Impetus for development of a PHEOC. Public health threats continue to be a major source of concern for member states throughout the African region. Recognizing that public health threats require a coordinated response, PHEOCs integrate traditional public health services and other functions into an emergency management model. Point 7. The WHO Handbook for Developing a PHEOC, Part A, Policies, Plans, and Procedures, describes various types of PHEOCs based upon capabilities and capacities. Point 7. The types were designed to provide best fit options for countries to select, given designated resources. 7. It is the responsibility of the member state to assess its own resources and select the option that best meets their specific needs and requirements. The PHEOC is part of a public health emergency management program that integrates risk analysis, preparedness, response, and recovery. Point 1. The program includes, but is not limited to, 1. Prevention and mitigation of hazards. 2. Enhancing readiness by stockpiling response resources. 3. Collaboration with related institutional and technical capacities and capabilities, example laboratories, community clinics, and rapid response teams. 4. Integrating public health surveillance. 5. Enhancing and integrating relevant multi-sectoral programs. 6. Engaging communities. 7. Training staff and validating plans. Point 1. 5. PHEOC planning guidance for legal framework development. A well-designed PHEOC implementation plan is a prerequisite for the development of a PHEOC. Point 1. The essential components to this process are 1. Establishing legal authority. 2. Forming an effective steering committee and policy group. 3. Developing main objectives. 4. Defining essential functions of the PHEOC. 5. Developing the core components of the PHEOC. 6. Training and exercises. 7. Costing, funding, and sustaining the PHEOC. And 8. Monitoring and evaluation. Point 1. This should involve other relevant sectors when the hazard has a multi-sectoral impact. 7. PHEOC Legal Framework Guide. 6. International Health Regulations, 2005. The International Health Regulations, IHR 2005, are binding on 196 countries across the globe, including all member states of 2.8 through IHR 2005. Countries have agreed to build their capacity to prevent, detect, and respond to public health emergencies and the international spread of disease. Point 8. Their aim is to help the international community to prevent and respond to acute public health risks that have the potential to cross borders and threaten people worldwide. Point 9. Building on the unique experience of global disease surveillance, alert, and response. The IHR specifically requires that countries define their national rights and obligations to uphold their agreement to meet the core capacities of IHR 2005. Point 8. Under Article 54 of IHR, countries are required to report annually to the World Health Assembly on progress made in implementing the regulations. Point 10. 11. Consequently, the obligatory state party annual reporting SPAR tool was developed by WHO in consultation with member states. Point 10. In addition, WHO and its partners have developed the Joint External Evaluation tool based on existing tools, which is one of the voluntary components of the IHR Monitoring and Evaluation Framework, EMF. 12. The Z emphasizes the impact that law can have on IHR implementation by stating that even where nations' legal systems do not require new or revised legislation to implement health systems changes, the revision of national laws may still be a more efficient, effective, or beneficial manner to facilitate implementation. Point 13. Specifically, IHR 2005 requires that states parties develop, strengthen, and maintain their capacity to respond promptly and effectively to public health risks and public health emergencies. Point 1. IHR 2005 presents a shared responsibility for global health security. The stated purpose and scope of the IHR are to prevent, protect against, control and provide a public health response to the international spread of disease in ways that are commensurate with and restricted to public health risks, and which avoid unnecessary interference with international traffic or trade. 14. Functions of IHR 2005 in emergency management. Establish a process for international collaboration and decision-making during public health emergencies. Require reporting of specific diseases plus any potential international public health emergencies regardless of origin or source. Establish a global network of 24/7 national focal points, NFP. Establish core capacities for surveillance and response for all countries at all levels, local, intermediate, national. Point 14. 8. PHEOC Legal Framework Guide. 7. Development of legal authority for a PHEOC. A functional PHEOC is an important component of meeting the IHR requirements. Point 1. PHEOC legal authority provided by legislation or government directive can be utilized to provide an entity, public health department, ministry, or agency, with the requisite authority to manage public health emergencies and is an essential component of a national emergency management framework. Point 7. To support the development of emergency management activities, a legal framework may be utilized to develop the requisite legal authority for the adequate operationalization of PHEOC. A PHEOC without legal authority lacks official mandate to better operate in the context of multi-sectoral involvement in the management of public health events. Point 7. While mechanisms for the development of legal authority will vary by country, the objective is to create an emergency management directive that identifies the specific requirements of a PHEOC. A PHEOC legal mandate can provide a basis for the following, among other, core attributes. PHEOC establishment. The range of roles and responsibilities in public health emergencies, example deployment of staff. Coordination mechanisms with local, national, and international resources for outbreaks and other health emergencies. A platform for budgeting and allocating funds for the PHEOC and emergency operations. Core staffing. Identification of the Public Health Authority as lead agency for public health response. Emergency powers, example authority for activation and deactivation of the PHEOC. Multi-sectoral collaboration, information sharing, and resource mapping. In addition, The legal mandate for the PHEOC can help to provide clear scope for its work and operational engagements. Point 7. This helps to ensure synergy among existing institutions and avoid potential confusion and unnecessary duplication of efforts. Any established legal authority must be consistent and compliant with the existing laws and emergency management systems. The comprehensive review of existing legal authorities and emergency management systems must be completed prior to the development of new authorities to determine if any amendments to existing laws and systems are necessary. The development and/or implementation of the National Action Plan for Health Security, NAPS, post-joint external evaluation also offers an opportunity to further consider this activity since national legislation is critical in supporting IHR implementation. Point 15. 9. PHEOC Legal Framework Guide. 8. Process for engagement and development of legal authority for a PHEOC. Engagement of champion to lead. Development. Process. Existing emergency management structures. Advocacy. Technical work group. Development of the legal framework. Submission. Review of relationship between the PHEOC and existing emergency management structures. Discussion and evaluation of current status of the PHEOC. Example: new structure, existing structure, or change of structure. Discussion of proposed or current organization structure of the PHEOC. Example: where the PHEOC is currently anchored or proposed to be anchored. Situational analysis. Example: SWOT. Development of a concept note. Stakeholder mapping. Description of technical resources needed to complete the process. Multi-sectoral communication and coordination to increase awareness of proposed activities. Development of terms of reference and scope of proposed activities for completion of process. Multi-sectoral engagement and review of documentation. Development of key priorities for inclusion in the legal framework. Engagement of technical work group and key stakeholders to complete a draft 0 based on the developed list of priorities for inclusion. Engagement of legal champions. Review of draft 0. Multi-sectoral validation of draft 0. Finalization and review of draft document by requisite committees and legal counsel. Submission to relevant authorities for approval. Assessment of additional SOPs, policies, or guides to assist with implementation. Engagement of key stakeholders to help ensure implementation. Assessment of additional legal authorities necessary to help ensure emergency management operations. Identification of an influential technical expert who can guide the process to completion, e.g., Emergency Operations Manager, e.g., Governance Council, e.g., Ministry of Health Legal Counsel, if applicable. 10. PHEOC Legal Framework Guide. 9. Overview of the PHEOC Legal Framework Guide. This guide describes 12 legal domains or categories of law frequently included in legal instruments and used to enable development of a PHEOC. Under each of these domains are listed attributes, details of which might be included in the domains or categories of law. Note that in some cases the attributes provide options, but not all will be relevant to the individual country context. The consensual decision rests with each member state. Recognizing that each country context is unique, it will be up to the country to choose which, if any, options are the most appropriate. In countries where multiple legal initiatives are underway, coordination is necessary to ensure that any new or amended legal instruments are not in conflict with any existing mandates both within the Ministry of Health, MO, and outside the MO. This includes review of potential conflicts with newly established structures such as national public health institutes, and PHIs, or other actors who are authorized to perform public health functions across the health system. The list included in the guide contains some of the key elements that may be included in a legal instrument for a PHEOC. It outlines how documents may be organized, but the order in which they appear, and the exact language used depends on the government structure and the country context. This information is given only as a general guide. The intention is not to establish a model legal instrument. The exact language used will depend on the government structure and the country context. Table 1. Domains to consider when developing a legal instrument for a PHEOC. I. Definitions. The legal instrument provides definitions of key terms. 2. Establishment. The legal instrument establishes and enables the development of the PHEOC. 3. Governance. The legal instrument establishes the governance structure of the PHEOC. 4. Functions. The legal instrument describes the core functions of the PHEOC. B. Medical countermeasures and personnel deployment. The legal instrument authorizes additional medical countermeasures and requirements for personnel deployment. 6. Activation and deactivation. The legal instrument establishes parameters for activation and deactivation. 7. Leadership. The legal instrument establishes the leadership structure of PHEOC operations. 8. Steering Committee and Policy Group. The legal instrument establishes PHEOC committees and groups. 9. Accountability and reporting. The legal instrument establishes reporting mechanisms. X. Financial resources. The legal instrument authorizes funding. 11. Effective date. The legal instrument sets an effective date. 12. Repeal, amendment, or transfer of prior authorities. 11. PHEOC Legal Framework Guide. 10. PHEOC Legal Framework Guide. Domains and attributes. Legal characteristics. See Annex 1 for full list of domains and attributes. Definitions. This section should include any term found in the document that does not have a standard or publicly accepted meaning. A few examples include public health emergency, National Public Health Institute, isolation, quarantine, and public health emergency of international concern. Any term used anywhere in the document should be used consistently throughout. 2. Establishment, creation of a PHEOC. This section is used to enable the establishment of the PHEOC. Formal authorization to establish the PHEOC is often included up front in the legal instrument, but placement will vary by country context. Table 2. Legal domains and attributes to authorize a PHEOC. Domain 2. The legal instrument authorizes a PHEOC. Legal domain corresponds to the major areas of law. 2.1. The legal instrument authorizes a PHEOC. 2.2. The legal instrument authorizes a national level PHEOC. 2.2.1. The legal instrument designates whether the national level PHEOC is permanently authorized or on an as-needed basis. 2.2.1.1. The legal instrument authorizes subnational PHEOCs. 2.2.1.1.1. The legal instrument designates whether PHEOCs are authorized on a permanent or on an as-needed basis. 2.2.1.1.2. The legal instrument establishes support, coordination, and communication mechanisms required by the subnational PHEOC. Attributes provide more detail about what could be covered in the legal instrument. Sub-attributes provide even greater details on subsequent areas to be covered in the legal instrument. 3. Governance structure. 3.1.1. 3.1.2 lists 2 general categories describing potential anchor points for the PHEOC. Depending on the governance structure, the general anchor points and terminology used may vary. However, designation of where the PHEOC is anchored within the governmental structure is a fundamental decision that must be finalized prior to the creation of the PHEOC. 12. PHEOC Legal Framework Guide. Table 3. Legal domains and attributes for the governance structure of the PHEOC. Domain 3. The legal instrument establishes the governance structure of the PHEOC. 3.1. The legal instrument establishes the governance structure or where the PHEOC is anchored. 3.1.1. The legal instrument establishes the PHEOC within the Ministry of Health. 3.1.1.1. The legal instrument defines where the PHEOC is anchored within the Ministry of Health organogram. Or 3.1.2. The legal instrument establishes the PHEOC in other governance structures. Example: National Public Health Institute, may be parastatal or in line. 3.1.2.1. The legal instrument defines where the PHEOC is anchored within the organogram. 3.2. The legal instrument defines clear terms of coordination between the PHEOC and national level leadership structures. 3.3. The legal instrument defines clear terms of coordination between the PHEOC and existing national emergency operations centers or all hazards commands. 4. Functions of the PHEOC. As part of the Public Health Emergency Management Program, the PHEOC functions commonly addressed in PHEOC legal instruments include elements of risk analysis, preparedness, response, and recovery. Sometimes, PHEOC legal instruments may provide significant details about specific PHEOC functions and scope of public health emergency powers. Some member states may choose to specify in detail the range of allowable functions of the PHEOC as well as specific limitations on those functions and public health emergency powers, while others may choose to leave the functions more general, particularly if the responsibilities and functions of the PHEOC and the scope of public health emergency powers are expected to expand substantially over time. This will allow enough flexibility to allow for changes in context, changes in technology, or even changes based on new or emerging threats. Specific attributes for consideration are included in Domain Table 4. Some broad considerations related to functions of a PHEOC are: 1. Defining the emergency measures to be implemented depending on the public health events involved. 2. Ensuring that all necessary plans and procedures for public health emergency management are in place. 3. Promoting an integrated and coordinated system for public health emergency management. 4. Creating and developing response plans and standard operating procedures. 5. Ensuring timely, event-specific operational decision-making, using the best available information, policy, technical advice, and plans. 6. Ensuring timely communication and coordination with national decision-making bodies and response partners. 7. Collecting, collating, analyzing, presenting, and utilizing event data and information. 8. Acquiring and deploying resources, including surge capacity, services, and material to support all EOC functions. 9. Preparing public communications and coordination with response partners to support audience awareness, outreach and social mobilization. 10. Monitoring financial commitments and providing administrative services for the PHEOC. 11. Liaising between the health sector and the National Disaster Management Agency. 12. Coordinating and alignment of systems with multi-sectoral actors and to subnational level. 1. 7. Countries may have legal standards in place that guide how much detail must be placed in legislation. 13. PHEOC Legal Framework Guide. Table 4. Legal domain and attributes related to the functions of a PHEOC. Domain 4. The legal instrument describes the core functions of the PHEOC. 4.1. The legal instrument designates administrative roles and functions. 4.1.1. The legal instrument requires the PHEOC to promote an integrated and coordinated system for public health emergency management. 4.1.1.1. The legal instrument requires the PHEOC to create and develop response plans and standard operating procedures for public health emergency management. 4.1.2. The legal instrument requires and enables timely communication and coordination with national decision-making bodies. 4.1.2.1. The legal instrument requires the PHEOC to serve as a liaison between the health sector and the National Disaster Management Agencies. 4.1.2.2. The legal instrument enables coordination and communication between and among sectors during public health emergencies. 4.1.2.2.1. The legal instrument designates a focal point, S, for multi-sectoral coordination. 4.1.2.3. The legal instrument enables the PHEOC to coordinate and align national actors with subnational actors. 4.1.3. The legal instrument requires the PHEOC to collect, analyze, and utilize event-specific data. 4.1.4. The legal instrument requires the PHEOC to create and define emergency measures to be implemented in accordance with the public health event involved. 4.1.5. The legal instrument requires the PHEOC to conduct public health emergency response training. 4.2. The legal instrument specifies the range of allowable functions for the PHEOC during an activation. 4.2.1. Surveillance. 4.2.2. Real-time biosurveillance. 4.2.3. Coordination and direction. 4.2.4. International reporting. 4.2.5. Communication with foreign EOCs. 4.2.5.1. Communication with subnational EOCs. 4.2.6. Policy making. 4.2.7. Supervision. 4.2.8. Evaluation. B. Medical countermeasures and personnel deployment. Medical countermeasures, MCM, are life-saving medicines and medical supplies that can be used to diagnose, prevent, protect from, or treat conditions associated with chemical, biological, nuclear, natural disasters, or emerging infectious diseases. 16. Having enough medicines and supplies can help save the lives of those who may need them most during a public health emergency. 16. A PHEOC is often more narrowly limited to the development and operation of the PHEOC as the center for managing and coordinating responses to public health emergencies. 7. However, in the wider context of a comprehensive risk management program, other pre-emergency activities are also concerned with enhancing preparedness and readiness independently of the operations and response planning that is central to the PHEOC. 7. Typically, these entail such activities as prevention and mitigation program, training and exercises, deployment of stockpiles of resources, and identification of backup supply chains for critical resources. 7. This identification of resources also includes planning and preparedness for ensuring sufficient personnel. While it is expected that states parties to the IHR 2005 will ultimately have well-functioning capacity to deal with public health risks and manage public health emergencies, it is understood that some jurisdictions have limited capacity for the type of planning and infrastructure development outlined in this document. 7. 14. PHEOC Legal Framework Guide. Table 5. Legal domain and attributes related to authorized medical countermeasures and personnel deployment. Domain 5. The legal instrument describes authorized medical countermeasures and personnel deployment. 5.1. The legal instrument specifies additional consideration for emergency management operations or medical countermeasures, for communication and coordination with existing emergency management entities. 5.1.1 permits the temporary involvement of national or international volunteers. 5.1.1.1 authorizes visa waivers for medical personnel deployment. 5.1.1.1.1 provides for expedited visas for medical personnel. 5.1.1.1.2 recognizes a corresponding license to practice from a foreign Country 5.1.1.1.3 recognizes international agreements to provide mutually recognized license to practice across nations in the contexts of an emergency. 5.1.2 specifies protection and liability provisions for first responders. 5.1.2.1 applies to all conditions that may arise. 5.1.2.2 applies when practitioner is carrying out duties under the scope of practice. 5.1.2.3 applies when practitioner is acting in good faith. 5.1.2.4 provides criminal liability protections. 5.1.2.5 provides civil liability protections. 5.1.2.5.1 provides indemnification for judgments. 5.1.3 permits the expedited acquisition and utilization of response commodities, example drugs, vaccines, etc. 5.1.3.1 provides priority authorization. 5.1.3.2 provides product authorizations for expanded scope of use. 5.1.3.3 provides provisions to manage duties, customs, taxes, or tariffs for medical countermeasures. 5.1.4 permits secondment of staff from other sectors. 5.1.5 permits requisition of property or materials from other sectors. 5.1.6 specifies the parameters to be outlined in international agreements for assistance in the event of an emergency. 6. Classification of incident and activation and deactivation of the PHEOC. The legal instrument should clarify who has the authority to activate and deactivate the PHEOC to respond to public health emergencies, example Minister of Health or other designated individual. Legal instruments should be used to ensure clarity in this process as well as the circumstances for activating and deactivating the PHEOC. Activation. Different grades or scales of emergencies require different levels of response. Different response levels are commonly defined in the response mode. 1. 7. The highest level of response concerns events of the greatest magnitude, scope, and impact, which also require the greatest resources and coordination. 1. 7. When the incident exceeds and overwhelms the capacity of the health sector, the response will require greater coordination and direction from the National Disaster Management Agency or highest executive authority level. 1. 7. In contrast, lower levels of response address smaller events for which the national PHEOC's capabilities and resources are largely adequate. 1. 7. 15. PHEOC Legal Framework Guide. Deactivation. Deactivation focuses on achieving an orderly return to normal by progressively scaling back response activities. 1. 7. It includes planning and preparation for when to disengage from response activities. 1. 7. It will also provide direction related to demobilizing, accounting for response resources, including personnel, and initiating an evaluation process such as an after-action review, AAR, or corrective action plan, CAP. 1. 7. The legal document often indicates the leadership structure for core PHEOC staff. Typical titles include Manager, Operations Officer, Planning Officer, Logistics Officer, Administration, and Finance Officer, but these may vary depending on the structure. In some cases, this core staffing structure may be left broad in the initial establishment document to allow for flexibility in staffing during the initial development of the PHEOC functionality. Table 6. Legal domain and attributes related to activation and deactivation of the PHEOC. Domain 6. The legal instrument establishes the parameters for activation and deactivation of the PHEOC. 6.1. The legal instrument specifies the circumstances for PHEOC activation. 6.1.1. The legal instrument specifies authority to activate the PHEOC. 6.1.2. The legal instrument specifies activation for public health emergencies. 6.1.3. The legal instrument specifies activation for natural disasters, in coordination with other national entities. 6.1.4. The legal instrument specifies activation for all hazards, in coordination with other national entities. 6.2. The legal instrument establishes the parameters and process for activating and deactivating the PHEOC. 6.2.1. The legal instrument specifies who is authorized to activate and deactivate the PHEOC. 6.3. The legal instrument designates a time frame for the initiation of coordinated response following activation. 6.4. The legal instrument provides mandatory requirements for disease reporting. 6.4.1. The legal instrument includes duty to report. 6.4.1.1. The legal instrument provides a reporting time frame. 6.4.1.1.1 Reportable diseases are specified under the law. 6.4.1.1.1.1 IHR reportable diseases. 6.4.1.1.1.2 Any uncommon illness of potential public health concern. 6.4.2 The legal instrument specifies mandatory requirements for international reporting of public health emergencies. 6.4.2.1 The legal instrument specifies government entity, IES, responsible for international disease reporting. 6.4.2.1.1 The legal instrument specifies IHR focal point for the reporting of human public health events. 6.4.2.1.2 The legal instrument designates a focal point for reporting to OI. 7. IMS functions and